Hello, my name's Kay Stevens, BSN RN, CCRN, and currently an SRNA at the University of Southern Mississippi. This is my community health assessment for population health. For my community health assessment, I chose Philadelphia, Mississippi, which lays in Neshoba County, which is my hometown. On this chart, I tried to list out just differences within the community, such as race, gender, age, and then towards the end of the graph, I gave just a total population, which is 29,000 people in Neshoba County. Of the 29,000, from what I was reading, it's about 9,000 inside of Philadelphia, Mississippi. Of this diverse mix, there's 7,000 African Americans, around 16,000 Caucasians, and then 6,000 other races, which consist of the Choctaw Indians. As far as males and females, it's about a 1-to-1 ratio. And then going on to age, you can see there's a big increase as far as the population goes in 44 years and younger. On this next slide, I just put a few pictures of the community. This is actually the square in town, which hosts some of the older buildings and stores of the city. And the bottom left corner is actually the Ellis Theater, which they have a lot of different plays that are put on there, and it's actually being renovated at the moment for future concerts. In the city, we actually have the Choctaw Indian Resort. They have their own casinos, which is the Silver Star Casino off to the right, and then the bottom left corner is the Golden Moon. They have their own Choctaw Indian Fair every year, and they also have their own water park. The top left corner is the Neshoba County Fair, which hosts, I believe, around 2,000 people-ish up in there. I put some more photos just to kind of describe the community. So this is kind of an older photo in the bottom right corner of the Choctaw Indians. The top left center area is a sign in town that's dedicated to Marty Stewart. He was a country music singer and still alive, actually helping with the renovation of the Ellis Theater. And the bottom left corner is a civil rights case that was actually in Philadelphia or Neshoba County. Going on, the community actually has two hospitals. So Neshoba General Hospital is a trauma level 4 hospital with 82 beds, and it's a nonprofit ran by a board of trustees that are actually out of Tennessee. The other hospital we'll get to in just a second. The services provided by Neshoba General Hospital is as listed on the slide. They do have some surgeries, physical therapy, of course. They do have their own nursing home, sleep center, wound care, etc., etc. Going on to their surgeries, though, they're included. They're able to do appendectomy, biopsies, breast surgery, colonoscopy, endoscopies, gallbladder, hemorrhoid removal, hernia repair, and laparoscopies. The community does have some clinics. So listed out, Rush Medical Clinic is actually a clinic that the main hospital is in Meridian, Mississippi, which is Rush Foundation Hospital. Going down, Fast Paced Clinic is actually a newer one, along with Fresenius Kidney Care. Those two are newer, but I know the Fresenius Kidney Care is for dialysis patients. We do have an urgent care clinic if needed, and Neshoba Pediatric Medical Clinic, which is underneath Neshoba General Hospital. We do have a health department in Neshoba County, and these are some of the tests that are offered. So a lot of STI tests, and then they were actually giving out vaccines for COVID and testing for COVID. On the Choctaw Indian Resort, they have the Choctaw Health Center. There's no trauma level designated for the health center. It's 20 beds. The services are only provided for the Mississippi Band of Choctaw Indians, and it's nonprofit government. I listed out some of the services provided, so they do have referral services just in case the services that they do include are not listed. And while I was working at Rush Foundation Hospital, they would refer us at times. So some of the determinants to healthcare that I kind of identified when looking at my community was health conditions, insurance, poverty, wages, and we do have an increased patient to clinician ratio just in Mississippi alone. So this is going to be some of the health conditions that I listed. So one of the good things that we're actually doing in the community is seatbelt usage, 92%. I believe the national is around 90%. That'll actually be on our next slide whenever we look at it. Binge drinking is slightly lower. We have decreases in high cholesterol and hypertension as well. This is going to be the United States health. Like I said, binge drinking, seatbelt usage, hypertension, high cholesterol, we're doing great on. Everything else listed, not so much. Vaccines, we're not compliant with. Depression is higher in Mississippi. We smoke more. Diabetes, arthritis, of course, obesity. We live in Mississippi and we like to eat good. This is the breakdown of insurance. So whenever I was initially looking at this, 12% of uninsured, I was thinking, okay, maybe it's not good, but it's not bad. But compared to the national average around 8 or 9%, Mississippi isn't doing as good as I thought. We do have a pretty diverse mix, but it looks like the majority is covered by employer coverage or Medicaid. Also found some interesting facts just to list on this. So adults in Mississippi that haven't been seen by a physician in the past year is at around 20%, 19.2. Our 30-day readmission is also pretty high at 18%. So Mississippi has the highest clinician to patient ratio and also dentist to patient ratio. We're around 2,000 for the dentist, 2001 for the dentist, and then 1,900 to 1 for a clinician. Moving on, this is the wages throughout Mississippi. So compared to the United States, we're about half of the wage of the median household income at $32,818. Gender, there's a big discrepancy with males making around 15,000 more, and then by races. So Asians and Caucasians are around the same wage. Of course, Asians have a little bit more, but compared to other races, both Asian and Caucasian do surpass other races by $12,000. This is the poverty compared by race and then just poverty in general. So poverty in Mississippi is around 31%, and then in the United States, it would be around 13%, looking at this chart. The African Americans do outweigh the other races, though, whenever it comes to poverty in Mississippi, closely trailed by Caucasians. So the sources that I used for my assessment actually came from a lot of census data from U.S. Labor Department and Centers for Disease Control and Prevention. was another resource that I used along with other ones that I referenced at the end of this presentation. Some of the strengths, of course, we kind of went over these that I could find is health conditions. We have decreased binge drinking, decrease in high cholesterol, hypertension, and we click it before we get a ticket, so more seatbelt usage. The weaknesses, though, severely outweigh the strengths. So increases in diabetes, obesity, arthritis, cancer, smoking, depression, disabilities, decreased compliance with vaccines, and then decreased exercise. Like I was saying before, 12% of Mississippians are uninsured, 8.6 of Americans are uninsured. Poverty is 31% in Mississippi, and 12.3 is the national average. Wages in Mississippi is 33,000 for the household income, and then the United States is 65, about 66,000. So we're about half. And then they increase patient to clinician, and then dentist ratios is the highest in the nation. So this segment is going to basically be kind of me boiling it all down, all the statistics that I got and everything. So if I was presenting to, say, stakeholders or just community leaders trying to bring out a project that would possibly help with this situation, this is how I would boil it all down to what we need to know and how we could possibly break the cycle. So out of all these, what we have in common is the no exercise. Whenever you don't exercise, you have an increased risk of coronary artery disease, obesity, high cholesterol, hypertension, diabetes, cancer. Those are some of the higher risks that I identified earlier and the weaknesses. Whenever you exercise, you can actually decrease obesity. So going forward, I tried to put together all this information to show that whenever you don't exercise, you have an increased health risk. We already established that, which leads to health conditions. That in turn increases healthcare costs. So if you're obese, there's a 40% increase in healthcare costs. This leads to increased insurance premiums. So increased insurance premiums, less money that you're able to spend. So low household income, poverty, which is a mix in Philadelphia. We have one of the lowest and well below the national average. Inability to afford insurance. So if you're not able to afford insurance, you're not able to go out, have a good time, your health's decline is terrible. That leads to more depression, and whenever you're depressed, the last thing on your mind is wanting to exercise. So, solution time. My solution to the problem is to focus on the exercise part. So whenever I would present this to stakeholders, community leaders, trying to find resources or funding for something, I would look at maybe a new program. The program that I just kind of came up with off the top of my head was no expense exercise program, the NEAT. So free resources. Free resources in the community would be the community parks. In Philadelphia, we actually have two of them. One's out at Burnside, and then we just have the city park. Another free resource would be bodyweight exercises, so push-ups, squats, lunges, etc. We could also turn this into a social media application you can download on your phone, Android, iPhone, just name it NEAP, or if there's a better name that stakeholders come up with, we'll we'll roll with that. So on there, I'd want to list out workout plans with progressive stages of difficulty, utilizing resources at the park. And it's always a good thing to socially connect people in your community, which if people with those social connections, hopefully some of the stakeholders will get out and actually do this program and get to meet other people in the community, and that could possibly lead to them seeing how some people are in poverty, and a lot of good comes out of community socialization. Listed below, I'd advocate for stakeholders, community leaders to fund for improvements to the city parks, development of personal areas for body weight exercise. This would be kind of a future endeavor after I come up with the product itself. Why body weight exercise? It's free. It's simple as that. Why the parks? It's free. Whenever you have a community that's in poverty, that's stuff you look for because they don't have the money to pay. Why NEAP? So whenever a lot of people go to the gym, they ask, what exercise do I need to do? And then some people, they like the social part of it. A lot of people go to the gym just to talk with people. So, gym partner, I don't have one. Well, on NEAP, I hope to have a social interaction, just like on Facebook or Instagram, stuff like that. I'd love to have where personal fitness trainers come together and work together to find out the best routine to go by and have a beginner all the way up to intense level on there of workouts that people can do. And if they don't even work out, I mean, they may just go walk with someone, interact with the community. I believe through doing this, it'll bring some social awareness of the healthcare resources, which we could actually list on the app itself. So bring more awareness to like the health department that's offered. It's a free service to people that need it. And then later on, I'd love to have improvements to the local park and maybe the full implementation of this plan in progress. So going on, I just have a list of resources that I used during this project. I actually ended up getting a lot of resources from the Centers for Disease Control and Prevention. You do see, let's see here, I did include some of the asthma facts in there. Going on, Centers for Disease Control and Prevention. I did find a Data USA and then one that hosted Mississippi's data is very informational. Healthline as well. I do have a resource from the Mayo Clinic, and Mississippi State Department of Health was a very good resource. They did actually have their own community health assessment, and I drew a little bit of data from there and read into it, seeing what they thought. And then U.S. Department of Transportation, which is where I got some of the seatbelt data from. All right, that's about it. Thank you.